Hello, I am Dr. Jennifer Jones, and I am reporting a transcript on um, my patient Evelyn James. This is session 1. It is a follow-up appointment to an initial assessment with another provider for um, PS630 Unit 4 assignment. Miss James was appropriately dressed for the session. Her clothes were clean and well kept. Miss James was oriented to month, day, and year with clear understanding of why we were meeting today. Miss James denied having any suicidal or homicidal ideations. Although Miss James had clear and coherent speech, she had difficulty with word retrieval and spoke very slowly. Miss James denied any substance use. Miss James had good eye contact when not searching for the words to respond to my questions. Miss James stated that she has been taking the paroxetine that was prescribed to her in her first intake session for her depression. The patient shared that she had been feeling extremely tired and weak, but had not noticed the difference until her family members brought it to her attention that she was acting noticeably different. The patient was under the impression that she was experiencing worsening signs and symptoms of depression. The patient was given some psycho education and informed about side effects associated with her particular medication, weakness, and lack of energy. The patient will be scheduled for weekly sessions to manage the side effects or manage dealing with the side effects of her medication. The patient has also been given a script to get blood drawn to determine a baseline for current treatment processes. Urine will be added to that. The patient was very grateful to have received the psychoeducation and expressed gratitude for the session and stated that she was looking forward to coming in to the office next week. So the transcript reads as such. Doctor, hello, Ms. Evelyn. I am Dr. Jennifer Jones. I am a prescribing psychologist. Your previous Dr. Karen Douglas asked me to see you while she was out of town for an extended amount of time to monitor your treatment and provide mental health services and medication management. Dr. Douglas stated that she informed her patients of the need for this transition to occur. How do you feel about coming to see me today? The patient. Hello, Dr. Jones. I'm very pleased to meet you. Thank you for being available to me during this time. I was a little nervous about what was going to happen while Dr. Douglas was away, but I'm feeling much better being here now, doctor. I will be seeing you for approximately 50 minutes today to go over your medications, your treatment plan, to answer any questions that you may have, and to offer any supports necessary to make this treatment process as comfortable for you as possible. Today we will not be talking much about issues in your life, although they are important. Since you started new medication in your last visit, we will specifically be focusing on if the medication is useful, understanding what symptoms you may be having, um, and how long you may have been having them. In addition, we will be looking at an overall plan to make certain we are addressing the problem and making certain we are on the right path with your medication. How does all of that sound? Patient. Thank you, Dr. Jones. That makes me feel even more comfortable. I do want to talk about how I have been feeling since I've been taking the medication. I find myself being extra tired, which causes me to have difficulty finding my thoughts and speaking at a normal pace. I'm just so tired. Everything feels like such an effort to include talking. I'm sorry. Was that not a good point to talk about how I'm feeling? Doctor. Miss Evelyn, please do not apologize for telling me how you feel. We are in this process together, and how you feel is very, very important to me. The fact that you are able to put 2 words, how the medication is making you feel, is actually very helpful to me. Sometimes medications have known side effects, and the more we know about the side effects that you're experiencing, the better. When did you first start feeling tired? Patient. I'm not exactly sure if I noticed when it was first started, but I did notice my family and friends starting to ask me if I'm okay more often. I'm used to them asking if I am okay as it relates to my depression. That is a more passive asking, as they do not understand my depression. Their asking now seemed more urgent. I could see the concern in their faces. That was about 3 weeks into my having started the medication. I started paying attention after that and noticed that I was visibly speaking slower and have to take more time to find the words that I want to say to express my ideas. I have been depressed so long, it has just become commonplace for me to always be tired and dragging. I just did not notice how much tired and how much more dragging I'd become. Sometimes I guess I just really don't care how I am feeling. I came to get help because I want to be there for my grandchildren. Normally I can put on a face for them so they do not know, but I have not been able to put on a face, and now they're asking if I'm okay, and I do not want that. Doctor, I am sorry to hear about the challenges that you are having. It must be difficult to explain what you're going through to a small child in a way that they can understand it. The good news in this case is that the medication that you're on, paroxetine, some of the common side effects are weakness and lack of energy. In our sessions, we can go over some ways to manage the side effects, and we can take a look at adjusting the dose or medication if necessary. We first want to give the medication ample time to acclimate to your system and to do what it is designed to do. Unfortunately, with some medications, it takes a few weeks for the medication to take its intended effect. Patient, Doctor, I'm so very glad to hear that. I was thinking that my depression was getting worse. My regular doctor did tell me something about side effects, but I did not believe I was listening the way that I should have been during the evaluation. Doctor, I am going to give you some literature and send you in a script for you to do blood work just as an evaluative measure so that I can determine a baseline from the time we started working together, and we will start to meet once a week. How does that sound? Patient, that sounds great. I did not know what I was going to do. It feels good to have some direction. I was so frustrated. I wanted to give you some attitude when I first came in, which I know wasn't fair to you. Thank you so much for hanging in there with me. Doctor, Miss Evelyn, no worries. I am here to support you through this process. We will get there. My medical assistant Dora will put in your script for blood work. It should be at Quest when you're ready. Dora will also make sure that you are scheduled to see me next week. Thank you so much for coming in today. I appreciate all of your time. If you get your blood work done between today and Friday, I should have the results by your next visit. Thank you again for coming in, and see you next week. I did just notice that in my written transcript, I forgot to type doctor before this last stanza, and I already submitted the transcript into the documents, but I am making the correction here. Also, I will be reading up more on dictation methods, and I look forward to continuing to grow in this process. Thank you so much.